Welcome to tonight's webinar from Brown University School of Professional Studies. The mission of Brown University is to serve the community, the nation, and the world by discovering, communicating, and preserving knowledge and understanding in a spirit of free inquiry. The Masters of Leadership in Healthcare at Brown School of Professional Studies is guided by that mission and seeks to develop healthcare leaders of the future. In the spirit of serving our communities, the nation, and the world, we are excited to be launching this series titled Lessons in Leadership, Let's Talk Healthcare. These sessions on leadership will cover a wide variety of topics delivered by academic leaders and executive practitioners in the field. These sessions are open to anyone who would like to join us, so please invite your colleagues and team members to the future sessions. All of our future sessions are listed on our website. Tonight's session is titled Building the Future Workforce, Adaptive Leadership and Resilience in an Uncertain Future. So let's get to it. I'd like to introduce you to Professor Henry Browning, an adjunct lecturer of health services policy and practice at Brown University and former design faculty at the Center for Creative Leadership. Henry has been coaching and providing leadership development training across industries for more than 25 years, and we're honored to have him as part of the MHL faculty. Joshua Johnston is the president of Talent for Health, a healthcare staffing firm headquartered out of the New York metropolitan area with a focus on innovative and technology-based solutions. Joshua joined the firm as president in late 2020 to help establish the firm as an innovative leader and trendsetter with a national footprint, with the organization emerging as a clinical and non-clinical solution to many of the top hospitals, clinics, and vendor management systems in this vertical. Under his leadership, Talent for Health is committed to their vision and mission of customer centricity, creating value for their strategic partners and helping each of their clients use information-powered and data-driven decision-making to collaborate on staffing solutions that drive each organization towards the goals of the quadruple aim of healthcare. You will hear from both of our guest speakers, and then we will open the session to questions and answers, which you can put into the Q&A box at any time during the session. Please put your in that section on the Zoom menu bar. And with that, I'm going to turn it over to Henry, who has his slides up and ready to go.
Thank you so much, Sandy. And it's an honor to be here with Joshua. This is an important topic for many people in healthcare right now. When we started putting together this series, we really did want to say what's going on in healthcare, given, and we didn't want to say post-COVID because COVID is still in full force out in the world. So it really is becoming a COVID-weary world. So we've been trying to do some research and saying, is something going on that's different in that? I spoke a couple of months ago around some research in a model that we're kind of doing and kind of trying to advance a little bit. And so I put this up real quickly because there was one bucket within the model that is the focus of this evening. And I think it's kind of the critical piece. It is this talent piece, and it's everyone's goal in healthcare is how do we all bring our best self to work every day and be able to make a sustainable process so that we continue to deliver on quality, compassionate patient care no matter what, even in these times where we're resource constrained, we're short on nursing, we have all these challenges within healthcare, mostly due to this COVID-weary world. So something to kind of think about there is how do we really advance this world? So in the original model, it's just talking about the complexities. And in the original research, no one ever mentioned that physician burnout in general, as far as what were the key challenges in healthcare, but physician burnout, nurse burnout, practitioner burnout was a key element in every single one of these buckets at the patient care team, at trying to get the right resources, at making sure we've got the right talent, at dealing with complexity. But today really is going to focus a lot more on that last bucket of engagement and well-being. And this is really focused as much as we can on all the people in that continuum of care, which I think is so critical. It's no longer just the hospital. The continuum of care is so diverse and diffuse. And so it's hard to actually define it, but how do we make sure that everybody in that continuum of care is engaged in that overall goal of quality, compassionate patient care? And I think in the end, it becomes, how do we make sure we're having a quality and compassionate talent aspect to all of our organizations, so that we hold on to physicians, we hold on to nurses, we hold on to these key people in the system. And so that's a little bit about what we're talking about tonight. I did speak earlier around this concept of what helps people stay engaged is making sure they're a part of this shared purpose, that there's energy when we feel our work is integrated and not compartmentalized to the degree, and we know we're a part of a bigger whole. But it's also, we're trying to get that engagement so that we have full accountability and to all the functions within the healthcare arena. So I think that that's what's critical in the leadership model. How do we make these the outcomes? Shared purpose, integration of the services, and accountability at every single role and every single level. And so that's our challenge in helping to provide quality, compassionate patient care. One of the things I wanted to talk a lot about is some recent research that we've been doing in the area of neurosciences. And I think you're seeing in the last 7 or 8 years so much research in the neuroscience of leadership, and nowhere is the neuroscience more apt a topic than studying the leadership inside of healthcare. So I think that's where I'm going to try to speak just a touch tonight around some new stuff we're looking at. We're trying to talk about leadership from the inside out. And this is kind of interesting, is we're trying to develop leaders for healthcare. We've been focused on behaviors for so long, but right now, what we might need to do is an additional shift and add, are we giving people the inner resources to be able to be resilient in these times of crisis and change? And I think that's where we're looking and helping to develop new skills about these internal resources that we all have to have in order to handle the complexity of healthcare as we find it in this COVID era. I did put this little slide in there for fun, and I don't know how many are on the phone, but just for the sake of this, the rest of this session, pick one of these images on the screen and have a little fun with it. But what was your biggest stressor today? I don't know if it was the inbox at 246, or the pile of paper in your inbox, or your cell phone going off, or government policy, or a bear bull market, or Democrat, Republican. I don't know what it was, but whatever the case was, think about just today, what was that key stressor that really made it hard to do your best on your real job, okay, or the rest of your job? And just pick a silly image and just jot down on a piece of note paper which image you selected. If it was the aliens in the spaceship, we might need to talk. But outside of that, most of these images are pretty industry focused. But have a little fun with this, because on one level, how do we start to keep our stress in perspective? And yet many cases, what happens in a stressful environment like COVID, the world does seem to become insurmountable. Our challenges become insurmountable when we just start to wallow in them. So how do we keep a positive mind? Here's some great definitions. I think when we talk about resiliency and how to bring our best self to work, I really like these definitions, because one of the things I think is so critical, it talks in both of these, it talks about the return to a nice status or stasis, or the recovery from a challenge. And so much of what I feel we're sometimes doing in the literature is just telling people, keep living with 100% stress all the time. And what's happening with that kind of mindset, we really are struggling to hold on to people. That's why we are getting the burnout. We're getting people leaving healthcare, is we just keep telling them to suck it up and do more and more and more and more, and never getting back to some level of rest in their process. And the neuroscience is really teaching us that there is some true physical and medical problems when we're just held to that level of constant stress. A lot of good articles out there. You all might want to go look up some of these, but if we start focusing on resiliency, there's several articles and research studies showing that we get better engagement with healthcare professionals. CEOs actually attain their goals much better, fewer depression symptoms, better return from cardiovascular, return to baseline with cardiovascular events, and less anticipatory anxiety. energy in dealing with some of these challenges. Today, we find so much, the latest term is rumination, that something happens on the job and we're constantly ruminating about what we should have done better or what went wrong. And that's really killing energy for us to go back and recover and get back in there and solve the next new problem. So how do we help executives come back to some baseline? I think the interesting thing that we have to recognize is what the neuroscience research is showing us more than anything is that the stress that used to be, developed when it was about lions and tigers and bears and we were trying to just survive physically, the same, cortisol, adrenaline, amino acids, all the same kinds of chemical body systems are at play with the current kinds of stress around cell phones, calendars, rushing to airports. The same kinds of chemicals are being released that used to be released with lions and tigers and bears. And what's happening is because these are a little bit more benign risky situations, people aren't stepping back from them. They just stay in that heightened cortisol moment and never ever back down and get to the recovery period. They just keep staying in that stress over stress over stress. And it's starting to have an impact. It's one thing when the cortisol gets released and the adrenaline gets released and we can get back to a baseline, but it's another thing if we're asked to keep pumping that cortisol into our system all day long for 16-hour workdays, which is sometimes what was happening, 18-hour workdays, 24-hour workdays when you're in healthcare. So you can imagine what we're not doing to help physicians and nurses and the rest of the healthcare professionals get back to some baseline. I think there's some good ideas. It really is, it is harming our body. We got to get people to start thinking about this. Sometimes there was a couple of studies around healthcare professionals are sometimes the least healthy of the people in the hospital, even the patients, when you look at the masses. So one of the things is how do we make sure our healthcare professionals are bringing their best self to work every single day so that they're performing at the top of their game? And I really think it's about relooking at how we teach in healthcare and also the expectations of how we manage healthcare. I think we've created some systems that work great for the last 50 years, but we might need to relook at how we both teach and manage the people resources of healthcare. That stress response, it's how do we get back to it? One of the things I'm really wanting us to maybe focus on tonight is to really start thinking about something kind of very simple. If you can kind of just key off, if you're constantly pumping out cortisol, you might as well be smoking 5 cigarettes a day. It's the same level of health, detrimental health behavior that you're engaging in as if you don't find a way to get back to that baseline sometime during the day. So it's a pretty critical aspect of it, experiencing that bad stress. And so one of the things we want to try to do is how do we do two things? Stress is what we experience when we perceive what we do, that we do not have the resources. So what we're trying to do more in teaching leadership these days is get people to kind of recognize you've got two options here, right? How do we decrease the demands? And that's been pretty difficult under the COVID challenges that we've been faced with. And the other side of that formula is how do we increase resources to help people deal with those stressors? You really can't do just one and not the other. We really need to focus in healthcare on both of these, make sure we're really looking at the demands we are putting on people and getting back to some level of a level of work that people can stay with the pace. And at the same time, we need to give people more resources for how to deal with those stressors. Another just quick exercise I wish you all do real quickly is do this quick we're not going to do it here, but I do this with a lot of physicians and nurses, nurse practitioners. Put down all the demands on one side, and then what are some of the activities you do that help you reduce that stress from the right side, and start writing just specific items and how big they are, and you'll start to recognize that probably one of the things we're not doing well is creating additional resources to help people handle the level of stress. We just kept throwing them at this challenge called COVID, and we weren't trying to do as many things as we could. I think that's what Joshua is going to help us with, is understand is how a lot of what his focus has been is to get people to really come up with better systems so that we can manage those resources and give people resources that are sustainable resources that can grow with the growing challenges. I always love this. We've been doing a lot more with meditation, with mindfulness. You're seeing it. Some of it I've seen in the press is pretty lightweight, but on some level, if you're not doing something to get back to normal, you're probably, feeling the negative consequences of not taking care of yourself. I just finished coaching an executive of a $6 billion organization, and for 15 minutes every day religiously he does some meditation, breathing, and yoga just to start his day, and he constantly puts in 16-hour days. So the idea here is, here's the busiest person in the world as for this corporation, and he ensures that he always takes 15 minutes out of the day to take care of himself. Sandy mentioned I worked at the Center for Creative Leadership. We found that senior executives who actually had some sort of health regime, exercise regime, actually worked fewer hours and were given higher rankings as far as effectiveness in leadership. So they actually worked about 5 hours less than the people who didn't take care of themselves in a week, and they got much higher ratings on like a 15-point scale or on leadership capability and leadership strengths and weaknesses. So what we do know is if you're taking care of yourself, you bring more energy to the job and you make stuff happen that gets perceived as more effective leadership. I like Tara Bach's just simple meditation to help us kind of get past some of these stressful times. I'm constantly looking for meditation and mindfulness work to help me get past just traveling in an airport these days is stressful enough. But the idea here is, she said, recognize that it's happening. How do you allow yourself, to really accept that, hey, I'm angry right now. Don't let go of it. Just be angry for that moment, or be sad for that moment. Be in that space. Just allow life to be where it is. Be stressed and try to recognize why what's going on in this moment is happening in that. So get to that, investigate that inner experience of, why are you feeling stressed right now? Don't run away from it. Don't pretend it's not there. Don't deny it. Actually let it happen, and then investigate why it's happening. And then really show some self-compassion and nurture, and forgive yourself for that short word or whatever that happened when you were totally stressed and you didn't perform at your best. But really learn from the event and do something different the next time around. Really become more aware in the moment. Awareness is a key competency of senior executives in healthcare. We've got to be aware when the stress level is getting to that point where we are not being as effective on the job. And that's the key piece that we're kind of looking at in some of our research, is helping people become aware when that stress is becoming too great. I still like the 4 disciplines. These are things that you can add to your mix, but I know that I know a lot of very strong managers would kind of resist any of these, but they are becoming, there's just solid research that says if we do some meditation, if we maintain some good social relationships with friends and family, that's a place where we take our stress and use it well. If we, the executive I'm working with does a gratitude journal. He's just gone through huge challenges with the supply chain challenges that have been hitting the entire world, and his gratitude journal helped him stay positive through all of that work. And then obviously physical exercise is, how do you do that to really get to yourself? So these are the things that we need to be doing as much as we can. And I know it sounds a little fluffy, but the whole idea is, if we're not doing something to get our brains back to some sort of even kill, if we just keep going stress after stress after stress, we are not bringing our best selves to work every day. And in healthcare, that is critical. So that's just our food for thought, coming from the research and coming from some of that work. I really do want to turn it over to the person who lives it and breathes it every single day within his organization. So Joshua, help me out, sir. Appreciate you being here tonight.
Yeah, I appreciate it, Professor Browning. You know, what my role in this discussion can really play is, you know, Professor Browning brings in the research and how this really, you know, ultimately affects us from, you know, a biophysical standpoint, from a leadership standpoint, and how that can affect not only yourself, but your teams, especially in a leadership role. So one of the first things I think of when I see what Professor Browning is discussing, and let's just say the word resiliency, is much like he said, it's a return to form. You know, how do you bend but not break? You know, especially in the moment. It's not to say that to be a leader, you have to be, you know, impenetrable, that you have to be superhuman. But if you have the emotional intelligence is a term I like to use to handle those emotions. And so for me as a leader, having worked with different people in healthcare, different people in different organizations and teachers throughout my career, one of the things that I know I can do is not project stress. For any of you who've ever worked under a leader or even a coworker, or colleague, or a teacher where, you know, the sky always seems to be falling, when there is a moment where resiliency would really help and they sort of revert more to panic or projecting that stress, or creating, you know, unreasonable expectations or deadlines. So one of the things that I feel like from a leadership perspective that we absolutely have control over is how much of that stress we put on other people. So if we can, much like Professor Browning said, be resilient, bend but not break when those moments happen. Let's say, for myself personally, I work in the healthcare staffing arena. So when COVID happened, all bets were off. No one knew what was going to happen for those 2 or 3 weeks in March of 2020. And I saw some companies in the industry, they started to lay people off. They had nightmares of the financial downturn in 2008 and 2009, and they thought, let's weather this storm. And much to Professor Browning's point, what they didn't do was be ready to reconfigure or redeploy or repurpose. So essentially adapt, you know, and that's one thing that I think when we talk about self-reflection, self-analysis, as Professor Browning stated, is you've got to be able to learn, and you have to, as a leader, healthcare professional, any sort of informal or formal leadership or decision maker in your organization, you've got to be ready to adapt. And one of the things is that self-reflection and that learning, and say, how do we use the resources that we have? How do we kind of slow down, you know, and make the right decisions? You know, so after COVID, one of the things to kind of reiterate, Professor Browning, I said to my team and my staff at the time, I said, this has already happened. We can't change that this has happened. We're not going to come up at the last moment with some innovative or blue ocean theory that's going to change what has happened. So we've got to adapt. And so I saw some companies, they laid people off and instead of repurposing those people. And then weeks later, you know, the government came out with funds to help people maintain status quo. And it's like, well, if you made those changes, you weren't even able to adapt. And if you know, made those decisions too quickly, you may have already affected the morale and the trajectory of your people or your organization without even having taken the time to kind of slow down and say, what's going to be the best course of action? And as any of you on the call may know, you know, layoffs or terminations, those increase stress levels exponentially, especially when you're relating that to a pandemic that no one from any of the current generations had seen. You know, it was a once in 100-year kind of scenario. And so, you know, that's one of the things I think goes back to how do you reduce that stress load? And so I think, you know, being emotionally intelligent, bending but not breaking. And there's different perspectives when it comes to that. You know, if you're the president or the CEO of a company, your probably first thought is, how are we going to weather this storm? Much like I just mentioned. But if you're a mid-level or an entry-level employee, you might just be thinking, how do I keep my job? And so those stress levels can be extremely different. If you're an entrepreneur in healthcare, you know, you may not think, well, it could be a couple jobs. It could be the entire business that is at risk. And so if you don't handle stress well, you're going to start to promote defense mechanisms and poor decision making. And those homeostasis kind of things like Professor Browning talked about will really, really hinder your ability to make the right decisions in those moments. And so one of the things I talk with my team about is trying to be a learning organization. And a big part of that is creating a psychologically safe space for people, is understanding that even myself as the president of the company, all the way down to the entry-level employees, we're going to make mistakes, but we've got to create a space where people feel they can make those mistakes. And that reduces stress, I think, exponentially, because as any of you know, it feels like once you make one mistake, those mistakes start to compound if you don't feel like you're in a safe environment to make mistakes. If you've got a supervisor, boss, or CEO where every decision seems to be the be-all, end-all of that business, that means they haven't set proper guardrails or created a learning space. It means you have to be perfect all the time, and no humans are perfect. Work is stressful, life is stressful, school stressful, parenting stressful. But to project it and add more onto it than what we're already working through, you know, doesn't promote that psychologically safe space for people to learn in. You know, so with that, and you know, one of the things I try to talk to people about as a leader is appreciation of differences. You know, I just mentioned the different perspectives, whether you're an entrepreneur, the CEO, or you just started on Monday, you know, everyone's got a different perspective. So you still have to be open to new ideas. You have to be open to diversity. And I think those things go back to emotional intelligence, resiliency, adaptive leadership. Because if you're not willing to hear those ideas, if you're not willing to create a psychologically safe space, if you're not appreciating those differences, you're just going to make knee-jerk reactions. You're going to create defense mechanism. And when you're a leader, again, that just adds more stress to the people who are already, you know, putting in that work towards whatever that worthy goal of your organization is. So if it's, you know, strictly caregiving, you know, healthcare administration, assisted living, or staffing, those people are going to be more prone to be stressed out. They're going to be more prone, like Professor Browning stated, to live unhealthier lives. Employee satisfaction goes down. So those are the things that I think, you know, you can work on to reduce that stress load, especially as a leader. You know, as an informal leader, I tell all my team, you know, you may not be the ultimate decision maker. Even in my organization, I'm not the ultimate decision maker. There's people I've got to report to, but you can affect everyone that you encounter, you know, regardless of whether you're that decision maker. And so if you project negativity, stress, you know, poor emotional decision making, if you have breakdowns every time a tough decision needs to be made, your organization is going to become a microcosm of that. And that's going to make things more stressful and more stressful. And you'll start to see that, you know, everyone in the organization will start to feel that. It's a very visceral feeling, stress is. You know, and then probably one of the interesting things from a resources perspective. So Professor Browning talked about resources versus demand. I was in the MHL program at Brown 2 years ago, when I joined my current organization, Talent for Health, and I had done a few interviews of people who had reached out for similar type positions. And one of the things they were offering for executives was 2 to 3 hours a month paid for with a licensed independent mental health practitioner, almost as mandatory, because they wanted you to have that resource where any of those gripes, let's say from a chain of command standpoint, when the gripes come up, it's usually going to that decision maker. That can be stressful. That can start to wear on you. And if you're not finding an outlet, if you're not taking that self-reflective time or self-analysis on how you're reacting to it, you may not even understand that you're projecting or making those poor decisions due to mounting stress. And I think that's something that's always important. I think that is, especially in healthcare now more than ever, because of COVID, because of the aging population, a lot of practitioners, caregivers are experiencing, unprecedented stress levels, dependent, regardless of what setting they're working in. And so if they don't have resources, as well as possibly decision makers who are stressed out and not being emotionally responsive or not being resilient with them or for them, it can create a whole domino effect of people who aren't making the right decisions, not only clinically, but possibly personally. And I think we saw that these last 2.5 years with so many people, the great resignation, were people saying, is it worth my health to be this stressed out? And you saw some people press it really far because they're born caregivers. They're born to work in healthcare, and they say, I owe it to these people. And so much like we discussed bending and not breaking, some of them found that breaking point was, I have to take care of myself. If my organization isn't offering me the resources to be personally and professionally successful, I can probably find someone that is. And I think probably the last point I would make with that is a lot of people say people don't leave organizations. They usually leave their boss or their manager, that person that's directly making decisions over their livelihood. And so sometimes when that happens to you as a leader or a prospective leader, you have to do that self-analysis, kind of that gut check of, what decisions did I make? How much did I project onto people? And that doesn't go without saying. I'm saying I like to practice being a learning organization. I like to practice emotional intelligence. So I've had to find that outlet, and a couple of those things Professor Browning talked about is meditation, exercise, speaking to someone on enough of an occasion, because if you are in that leadership type role or managerial type role or caregiving role where you're absorbing other people's possible negativity or their ailments or diseases or just the common stressors of being in that leadership or decision-making role, you've got to learn where to pass that. It's got to go somewhere. Otherwise it just builds up. So my team likes to joke that I'm always 72 degrees. That's just on the outside. The inside, I may be boiling. I just try not to project that on to people because it's not going to set anyone up for success. It's not going to set myself up for success. And so you still have to have an outlet for that, because you can't just put a lid on it and hope it cools down. So I really enjoy this topic, and the research that Professor Browning has shown is, stress on a day-to-day basis is palpable. I mean, it really is a visceral thing that can start to compound. And I think if you're seeing compounding issues, things that maybe you've felt at one time or another, or continually, I'm not resilient enough for this, they're very easy self-reflective things where you could stop and say, this is the culprit. This is what's doing it, and here's how I can fix it. And I think sometimes when we're a leader, we get too caught up in being right versus getting it right, and getting it right sometimes says you have to stop and say, I need help with this, or I don't understand why this is going on. getting an outside perspective from someone. So I think for both, kind of final point from what Professor Browning had to say is you've got to understand what those resources are, whether you're an entry-level employee or the CEO of the company, and you've got to use them. I feel like most research goes back and says most companies don't need to change their processes or their resources. You just need to have people follow them and use them. They're there. But if you're not using them, then you will kind of build up that temperature and steam, and eventually it doesn't end well. So
your organization helps out a lot of other organizations around the talent challenge. What have you seen? How did organizations pivot successfully to handle some of this craziness and chaos that came with COVID? And what was an example also of an organization that pivoted and missed the boat? I'm just curious. If you don't have to name names, but you support a lot of different organizations out there, it would be hospitals and clinics and things. What have you seen was positive in an organization?
Yeah, so one of the first ones I would say is one of our bigger clients is in New York City. And what they did was they created some on-site things for onboarding to make it less stressful for the people who are redeploying into New York City. It's one of the biggest cities in the world, biggest city in the US. So it wasn't easy for people to redeploy there. And so they offered some things that typically wouldn't happen in healthcare staffing, or some leeway on licenses. Not only did the hospitals do that, but the state agencies came in and said, we've got to make this easier. This is unprecedented. A few of the ones that I saw that were negative were the places that stayed steadfast. There were places such as the state of California, some areas in and around Houston, where they weren't willing to adapt those first few months. And it really turned into a quagmire of just people quitting. You probably saw it on the news where they didn't have enough caregivers. People were sick, people were dying at an unprecedented rate, but it's because they didn't want to adapt. They thought, well, we can handle this with status quo. And you saw it, too late. That happened in March of 2020, and we had facilities coming to us in August and September, finally saying, how can you help us? And it was like, well, we're 5 or 6 months into this. This was something we were trying to approach you with months ago. So again, I think it was just adapting. It was saying, the old adage in any industry is, well, we've just always done it this way. It's absolutely the worst way to think.
So can you speak a little bit to healthcare right now is kind of in a chronic shortage position in terms of its overall level of staffing, and the pipeline is is a bit slow to build up, whether it's nurses, whether it's physicians, nurse practitioners, physician assistants, like the relief is not coming. So how do we in healthcare think about this challenge?
Well, so from my vertical being healthcare staffing, a lot of times CFOs, chief nursing officers, they look at the cost of an agency nurse and they say, well, it costs more than what we're paying a staff nurse, but they're not looking at how long has that job been open. So that Indeed typically says the average nursing job for a permanent position sits open more than 52 days on average.
Wow.
So if you talk about not only the cost of decreased employee satisfaction, not only are they not paying the money to bring in that supplemental staff, but they're paying current people overtime wages. And as we saw during COVID, there's only so much utility to overtime pay when you're working 48 and 60 hours a week. It eventually doesn't become worth it. And so you have to figure out, are you foregoing your current employees' satisfaction at the behest of not adding someone that could reduce, again, that stress, that workload for them, that job sitting out? payroll taxes, the addition of having an HR staff recruit those people. And it's also in the federal code that any medical or caregiving facility needs to have a backup plan for staffing. And so if they're not utilizing a local per diem registry, they should be working with some sort of an agency. And I think COVID really pointed that out, is the places that were in the most dire need, they didn't have time to stop and say, let's add some more recruiters, let's put together a nice benefits plan, and hopefully we'll find 500 people to start work this month. It's just not how it worked. And so, again, it's that adaptability. You may not need it all the time, but you should understand what happens when something really negative happens, like the pandemic. And so, obviously one of the reasons why there's this big nursing shortage still goes back a little bit to money, and not to go too far into the weeds, but there's not enough people graduating every year because it's not as lucrative to teach nursing as it is to maybe go into nursing administration or, nursing education within an acute care facility or long-term care facility. But we know that's not going to be fixed today or tomorrow. So knowing that, I think that's where acute care and non-acute care facilities should take that look at. How do we keep our staff happy? And if that's bringing in supplemental staff for short periods to reduce stress, reduce workloads. And it's also been proven that those increases will increase patient outcomes. So not only is it good for those who are really committed to healthcare and to healthcare outcomes, it's good for facilities when it comes down to some of the things that pay their bills, like Medicare and Medicaid scores, even just patient reviews from any, sort of national data collection agencies that keep those scores and reviews of patient satisfaction.
Thank you. So we have a question from our attendees. This is from Jedri, founder and Chief Nursing Officer at Angel Care. He says, in regard to bending, not breaking, and emotional intelligence, clinicians are trained to understand it. How do we reduce the cognitive load regardless of the, like, let's say you're managing the cortisol release, the fight or flight response, but like, how do we like reduce that cognitive load?
Well, I think there's a numbers solution to that, but I also, Joshua, you've got some better answers for that, I believe, because I do think some of that cognitive load is the complexity. One of the things that's happening is kind of a larger healthcare issue around the aging population, and they're no longer coming in with single issues. They're coming in with having multiple physical ailments, and that have a collective effect. And so therefore, it's obviously the cognitive load's getting harder because of that complexity of the patient. It's just not nice and clean and simple anymore. It's a much more complex patient as we see that aging population coming in with multiple ailments, and not an easy way. So I do know that's we need more people in geriatric medicine, obviously, because that seems to be a big challenge. But that's a tough one with the cognitive load. There are exercises to pull yourself back and actually recover from intense cognitive ability. And that's where some of the meditation is designed to calm the brain so that you can go into the next room or the next bed and be recovered. There is a personality type that's obviously we've looked into, that some people easily recover from stress, and others probably emergency medicine should not be their job because they don't recover quickly from the stressful situations. So that's one of the things we have to help people understand is really making sure they know what their recovery process is, and they know how to do it. So that's one of the things we're trying to research for people, both from a personality point of view and emotional intelligence point of view.
So I've recently even seen some hospitals that have discussed how they've taken, Apple Watch data or even Fitbit data to kind of keep, and I don't know what term they use, but similar like an NPS, like a net promoter score of like, what was that person's stress level and output during the day. I think a lot of pro athletic teams are using that now, like what goes on during an actual game to that person's body. Very similar, nursing, physical therapy, allied health sciences. These are contact sports. So how many steps is someone taking in a day? How many times does their heart rate get elevated above, 80 or 90 or above whatever their resting heart rate is? And so I've seen some research where they've talked about how can you maybe manage that data over the course of a month and try to put it on a weighted scale of what someone has been through, during that time. Now, I haven't exactly seen how that has been related to, necessarily cognitive or how they're giving someone a release from that workload. But I certainly think measuring that is probably the first step in creating something, especially when we talk about all the technology available for healthcare, making it available for the healthcare providers to say, this month you had, 2 patients code, your blood pressure, your pulse was above this, elevated for more than an hour in a 12-hour workday. That's equivalent to running 8 miles, or as Professor Browning stated, if it was all stress related, it's equivalent to eating a Big Mac and smoking a pack of cigarettes. It may not all be healthy just because it's activity.
Right. I find that, like everyone has sort of their own coping mechanisms. So like my informal reaction, and not based on any scientific evidence, is training people to be present, like in the moment, and to reflect on what's in front of me right now. Like what's, like I have this list of 100 things that I need to do in my head, but what's, like think about what is in front of me, this patient, this moment right now, or even, like I'm not in patient care anymore. So what's the big, if I make a list and say, okay, but these are the 3 things that really will make a difference if I do these 3, these things, and helping people to focus. But how you sort of accomplish that on a large, sort of a large scale organizational process, like that's like a mystery to me. Like,
well, I think to your point, Sandy, and to kind of go back to Jedri's question a little bit is, and to kind of circle it all into what Professor Browning says, those ruminating thoughts, if you're, going from someone who's coded to someone who's, lost a loved one, to someone who's been through a major trauma, in terms of a patient load for a nurse, how do you prevent those ruminating thoughts? Well, sometimes it's because literally you're just moving so fast. Well, that's not a good remedy for ruminating thoughts. And if you are ruminating, then much like you just said, Sandy, you're not living in the moment. You're not taking in what's going on. And so you still may make maybe not poor decisions, but you may not be making the most proactive decision. You may be kind of going through the motions from muscle memory and not actually thinking, here's what I'm doing. And to Jedri's question, I think, that's probably long been a question of how does someone handle that cognitive load of, you're not moving from paperwork to paperwork. In some cases, you're moving from life on the line to someone passing away to someone, going through a high trauma injury. How do you compartmentalize that and move on and move on and move on? In some cases, you may not, you may have to take a step back. And so I think, if going back to that research, if there's some way to do that for nurses, physicians, any healthcare professionals, and let's just say an acute care setting for discussion's sake, how do you measure what have they gone through in a day or a shift or a week or a month? Someone who's working in an ICU or an ER, it's going to be significantly higher stress and cortisol levels than maybe someone working in a medical surgical unit or a telemetry unit. So how do you measure that? You know, ER nurse always says, well, I'm an adrenaline junkie. Well, everything's only good in moderation. You can't hold that adrenaline level for that long before you finally have a crash.
Right, right. So I know there was one other hand raised at one point, and they haven't put the question in the chat, but Robin, did you want to ask a question? I can turn it on so that you can speak. Are you willing? Do you still have that question? Oh, great.
Hi, Sandy. No question for me. Enjoyed listening. Thank you.
Okay, great. All right then.
I think Joshua did mention a couple of things that I really want to highlight, because on one level, I think the psychological safety piece is so critical to how do we create that environment where people can speak up in the moment, because that's one of the ways in which they release that cognitive load and prevent that rumination. So if they're in an environment where they can't speak up or it's fearful to speak up, then that's a real key issue. And I think that's something the psychological safety research is really powerful in helping people feel like it's, keeping stress level down and also higher engagements.
Awesome. We are about at time, so I don't want to, we'll try to keep these sessions to an hour. So thank you everyone for participating and for the great questions and conversation that we've had tonight. I want to highlight that we have 2 sessions in September. One is on Monday, September 12th. Our faculty members, Jim Austin and John Park, will be having, it will be a blended program. They will be in person with our guests in person here at Brown, but you will be able to join virtually as well. And they're going to be speaking, the topic is how to lead in turbulent times. And the guest is Kate Haviland. She is the CEO of Blueprint Medicines, which is a company that despite COVID, really managed to bring their scientific research and ongoing developments and strategy to succeed. We're able to keep that going during the pandemic. So she's going to be a fascinating conversation. And then on Thursday, September 22nd, we have a program titled Reflections on Supply Chain Challenges During the COVID-19 Pandemic. And our guest is an alum of the program. Her name is Dion Dosa, and she's the executive director of CMC procurement at a company called Moderna. So if you can imagine, she has some really fascinating insight into the challenges that were presented to them, not only from a supply chain standpoint, but the expectations on them as a company to produce the vaccine, deliver the vaccine, and all of that. So Dion will be a terrific guest on Thursday, September 22nd. So thank you all so much for joining, and I look forward to our next session. And thank you to Joshua, and thank you to Henry for joining us tonight. Have a great night, everyone.
Thanks for having us. Thank you.
Thanks, everyone.